Okay, everybody, so these next two techniques are going to be targeted at OC1. It's where the occiput is held and cradled by the atlas. Um, this is usually involved and usually limited with head nodding motion, people with headaches, jaw pain, ear dysfunction, a number of different disorders living right around this area right here. So the first technique we're going to go over is an isometric technique to work on extension or backward bending at the OC1 region. What we're going to do here is we're going to get our fingers similar to that suboccipital release position underneath the base of Kelly's skull. And then the next part we're going to do is we're going to block the top of the forehead here, right? What we're going to cue the patient to do is to lift the chin up, right? But we can't necessarily block at the chin. That's too far away, and it's kind of hard to do. So where we put the block is right on the top of kind of like the eyebrows right here. Okay? This is really good to get an isometric contraction, a contract, relax, right around the suboccipital region, and get some mobilization around that OC1 area. So we're going to get into position. I'm going to get all four of my fingertips underneath the base of the occiput, kind of get into a lunge position here. I'm going to do a little traction. And I'm going to do depression right on top of the eyebrows. Kelly's going to go ahead and lift her chin up. As she lifts her chin up, I'm pulling the base of the occiput towards me, and go ahead and rest. Good. And again, lift up. And go ahead and rest. Good. And one more time. Excellent. Really nice, easy technique, gentle for the patient, non-threatening, and you get some good mileage on restoring some capital extension with this technique. Now, on the flip side, to restore capital flexion, this is another technique that I use often and frequently. I learned it in my MCT training over at St. Augustine with Stanley Paris. So what we're going to do, this is called a unilateral head nod. I'm going to use my left hand to treat Kelly's right OC1 joint, but I'm going to use my left middle finger. So we're going to scoop underneath the base of the occiput on the right side. Good. I'm going to do a blocking technique. So I'm going to drop right underneath the base of the occiput on the lamina of C2, because you can't necessarily get on the lamina of C1. And we're going to do a posterior to anterior force, which is going to be the block. This motion, to get some of the head nodding motion back, is going to be a curvilinear motion. So it's not just going to be the nose going down towards the chest, it's going to be the nose going down towards the chest and the opposite arm. So I'm blocking on the right side, and I'm tucking the nose, and I'm going up and over, and come back. This technique's very effective, can be somewhat uncomfortable for the patient, so you just want to let them know. Good. So we block, translate down, rotate to the right, good. Block, translate down, and rotate to the right. Two really strong, effective techniques for OC1.